closer you can.
Blood, page 539.
Oh, you're in the chair. Okay. Justin?
There's a truck there.
Go up on the sides if you like.
Why is it not showing up on my... Oh, there it is.
It takes a while for them to adjust.
Oh, yeah,
So
you're right.
you've seen blood before, so that's not going to be too unusual. What you have to look for, though, is being able to identify the leukocytes, the white blood cells. There are 5 different leukocytes, and I'll show you how to break those up. But if you look at that page on 539, you'll see the 5 different leukocytes. The best way to look at these are, some of these are granulated, some are agranular, but the key is to look at the nuclear formation or the granulation formation. Because each one of these particular leukocytes has a very specific pattern of the nucleus. Like if you look over here under neutrophils, you'll see that there's at least 3 plus, but a minimum of 3 different land masses, so to speak, when you're looking at neutrophils. So anytime you're looking at a leukocyte and you see 1, 2, 3 different land masses, at least like that, that's going to be a neutrophil. And those are the most plentiful out of the leukocytes. About 70% of all the leukocytes are going to be neutrophils. If you look over here, you're going to see that there's this, almost everything's totally encased in, except where you have a halo.
Lymphocyte?
And those are going to be your lymphocytes. So whenever you see a totally encased leukocyte, but then there's a slight ridge around it, we call it a halo, that's going to be a lymphocyte, either a T cell or B cell. All right. The other ones you can't see too well, but there's also these little structures. These here, there's one there, there's a couple there and there. Those are fragmented megakaryocytes. What are they? Platelets. Remember, they like to ask that question. What do platelets come from? They come from megakaryocytes. Megakaryocyte actually fragments or fractures, and the pieces make up the platelets, which are like sticky little substances. Mega, it's M-E-G-A, and then keratocyte, K-E-R-A-T-O, and then cyte. So you kind of look around here and see if you can pick up any more of these. So, because they'll throw some up here that, all right, that's somewhat atypical, so we're not going to use it. All right, here's a good one.
There's one.
Based on the nuclear shape, this should be easy to tell what this is. If you look on your textbook, this is a monocyte. We call it a fat C or a fat U, depending on which way it's actually positioned. But it's very distinctful in its nuclear shape, so it's easy to see this is a monocyte. Now what you probably may want to learn also, not just for lab but also for lecture, is if you look under here, each one of these has a kind of a specific attribute or characteristic. One may be very good as a macrophage or phagocytic, the other one may be good at releasing histamine or heparin, the other one may be good for fighting parasites or viruses. So make sure you learn not only the leukocyte, identify them, in case they ask you one function of each of them, you may want to do that as well. These are a bunch of platelets all through here. That's just, this is actually an autolysed leukocyte. It's actually lost its membrane, it's breaking loose and open. So based on what we know, what is that?
Neutrophil?
Neutrophil. You guys are getting this, not too complicated. All right.
That's just to remember the parts of each one. Neutrophil?
That one's really big. I think it's a monocyte.
But it almost looks like it's not connected though, like masses. It's kind of
Could that be an eosinophil or is that another neutrophil?
I think it's a neutrophil.
what?
It's big.
Eosinophil
I think it's that.
orange too as well, in color.
You think it's that, an eosinophil?
Yeah.
Say that.
I think it's an eosinophil.
Okay, good. Just want to make sure you can say it.
Is it?
Tyler, what do you think it is? Peter?
I would guess it's a neutrophil.
Still a neutrophil. Now, why isn't it an eosinophil?
Does it have a wrong color?
Because it's not
the wrong-
granulated in the
Because it's not granulated and it doesn't have, so you're going to see that Here's a landmass, here's landmass, and there's this thick connection in between. If you look at eosinophils, sometimes they're not connected or they're very, very thinly connected. And you look like, they literally look like an alien when you look at them. These two big eyes with a slight connection in between. At least aliens that we've perceived to be aliens.
Yeah.
That's a neutrophil. All right, so here you got two more. What are these? Both of them are neutrophils because they have at least 3 or multiple land masses. Still a neutrophil. Remember, 70% of what you're going to find are going to be neutrophils. Neutrophil. 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 That's how I can count RBCs. People do this for a living.
Oh
Don't you
my
just count
gosh.
within
You count a section and then you multiply it by the total space on this line.
Can't they get a computer to do that?
Yes, thank God. They used to,
Maybe some people do it for fun.
here we
Oh,
go.
there's a good one.
All right, so
It's beautiful.
so we have 3 different leukocytes. What is the one on the upper right?
Neutrophil.
What is the one on the upper left?
That's a lymphocyte.
How do you know it's not a basophil?
doesn't have a halo.
But it doesn't, it's not granulated?
It's not granulated and there's a halo on it. Very good.
Is that halo?
And of course another neutrophil down below.
Where's the halo?
I can barely see it.
So this would be a lymphocyte. There's a halo here and there's one there. Plus it's not granulated. If we ever see a basophil, it looks very similar to that, but they're huge. And they look like they have a bunch of shotgun pellets in it. They're granulated. For those who know what shotgun pellets look like. Here's a classic halo. Way out here like that. Very easy to see. What's the function of a lymphocyte?
Immune system, immune function to destroy infection.
What are the 2 different types of lymphocytes?
T and B.
T and B. All right, what is this?
Monocyte.
Why isn't this a lymphocyte? Lymphocyte. Lymphocyte.
Because it doesn't really have a halo.
Doesn't look like a
that.
halo.
It's-
It's like it's shaped usually.
Is a monocyte granulated?
No.
No.
Yeah.
Are they gonna look
Looks like it. It has like a
Looks
chunky
like-
nest.
I'm not gonna you though. Let's make that soft to you.
No,
Generally, you will
monocytes-
not see a big impression like this for a halo. You'll just see a shadow. That's why it's called a halo around here. This is kind of an elongated, rather fat-looking monocyte.
And they're huge.
So you kind of get the idea of what we're looking at. I'm trying to find a basophil. There's something interesting here.
An alien.
Or an eosinophil. Can you see those things?
Appreciate that. Payback's a big chunk. Yeah, they're putting you on it.
See any granulation on that, or is that still a lymphocyte?
Seem like 2. Because you can't see it.
All right, here's the halo. It's still a lymphocyte.
Neutrophil.
Okay, that's a kind of a slightly atypical lymphocyte. Same thing. Generally, once they actually find one that has the same thing, they usually will save the slide so we never get to see it. They're really hard to find. They only make 1 or 2% of the totals. Am I getting dizzy?
Yeah.
That's a classic lymphocyte. All right, so I think we've seen enough of this.